This is LA Business Spotlight.
Greed is good.
Always be closing.
It's strictly business.
Welcome to LA Business Spotlight. I'm Joel Metzger. My guests today are doctors Sean and Ben Behnam of Dermatology and Hair Restoration Specialists, which was recently named one of the top 25 surgical clinics in the nation by Newsweek magazine. Welcome, doctors.
Thank you for inviting us.
First of all, you're twin brothers.
Yes, we are.
Who does what? Dr. Sean, you go first in the practice.
So in the practice, I only focus on hair loss and hair transplantation.
I'm a board-certified dermatologist, and I do all the dermatology as well as cosmetic lasers in the practice.
Okay, well, we'll start with hair transplants. Dr. Sean, what is it and how does it work?
Well, hair transplant is actually a simple procedure. It's just very precise and it takes a lot of time and dedication. Very simply, hairs are taken from the back of the scalp, and these hairs are permanent, they do not thin out, and they're placed in balding areas. So it's a one-day procedure, and basically, we remove as many hairs as we want, and we place it in the areas that we need, so people can have a great set of hair afterwards.
How is this different from? There are medications, right? So why do surgery?
Well, because hair transplant is the only permanent solution to hair loss. Yes, there are medications, there are oral medications, there are topical medications, there are even some lasers that stimulate hair growth. They have to be used every day, and once somebody stops using these medications, hair loss continues. With hair restoration, it's a one-day procedure, and then you don't have to do anything else. These hairs are permanent and they just keep on growing. It's your own hair. You could, wash it, cut it, comb it, and it feels great.
And what makes someone a good candidate for this?
Well, a lot of things actually are necessary to make sure someone is a good candidate. But one of the most important things is that they have a solid, permanent donor area. The donor area are the hairs in the back of the scalp, and if you've seen some men that have aged a lot and they have lost a lot of hair, but they still have a horseshoe rim of hair in the back of the scalp that has not thinned, that area is permanent. And some men have a generalized hair loss, or some women have a generalized hair loss where they thin all over. Those people are not good candidates. But if somebody has good solid hair that is permanent, they are great candidates.
Now, I noticed on your website, Dr. Sean, that you guarantee natural results. What do you mean by natural results, and how do you guarantee that?
Well, natural results mean that if somebody were to have a hair transplant, that nobody else would notice that they had any procedures done. People would just notice a fuller, thicker hair. And the way I guarantee that is I have really perfected the process of hair restoration. Our techniques have improved, our technologies have improved. I do a lot of research, and it's more of a technical question, but the way I put in the grafts and the grafts that I place, the results look very natural once they grow out. That means the hairline should not be straight, because if it's too straight, then it looks too good. And there are actually some protrusions that come of the hairline, that come forward, that come backwards, and it gives it a natural appearance, as if this is how it goes naturally. And this is what people really enjoy about it.
So speaking of grafts, help me understand this. You have a flat fee pricing. That's per graft, or how does that work?
So the way it works is that when we want to place the maximum amount of grafts, let's say somebody's significantly bald and they need over as many grafts as they can get, we have a flat fee price such that with one price, we will get as many grafts as possible. So at the end of the day, we get more grafts, and we really don't like to have any surprise charges on the day of the procedure, but rather we try to put as many grafts as possible, because once people have a great result, it's as if I'm having a great result.
Right.
I get happy when people are happy, and that makes an important difference.
That's great. So you require some kind of a scalp stretching exercise. What is that?
Exactly. So people have a homework. In order for us to achieve that maximum grafts that we can get in one day, people would need to do a scalp exercise to stretch the back of the scalp so it's loose. So the more loose it is, the more tissue and hairs that we can get out. And ever since I've been doing this, people have loved it, because we've been achieving high number of grafts for every individual, more than expected, and this results in better and more natural results, and it's amazing. And since I only do one case a day, I dedicate my entire staff and my time to making sure that your results come out just great.
Okay. Well, this is all good information. We're going to take a break. This is LA Business Spotlight, and we will be right back with doctors Sean and Ben Behnam.
LA Business Spotlight is brought to you by Icebox Logic, makers of fine handcrafted audio and video. Go to iceboxlogic.net to see examples. Your company needs to communicate.
We are back with LA Business Spotlight. I'm here with doctors Sean and Ben Behnam of the Dermatology and Hair Restoration Specialists. Let's switch over to acne scars, dermatology. What, Dr. Ben, what is a fractional CO2 laser? Isn't that what you're using?
Yes, the fractional CO2 laser is the gold standard in the industry for treating acne scars on the face. The acne scars could be very emotionally sabotaging for a lot of people out there. And till right now, we didn't really have like a very good treatment options. But as the laser technologies becomes better and better, we're finding better modalities to treat those patients. So currently, we use the fractional CO2 lasers, and we do resurfacing on of the face. What it does is basically removes layers of the skin and stimulates collagen production to fill in some of those depressed acne scars.
And how does it work on darker skinned individuals?
We have to be a little bit more cautious on darker skin individuals, but with skin preparations using bleaching creams before and after the procedure could be done very safely.
Okay. And is it a one-time treatment? Is it more than one? Or?
It all depends upon the skin color as well as the severity of the acne scars. Typically, I say more than one treatment is required. Some patients might need between 2 to 3 sessions, spaced out between 6 to 8 weeks apart. But again, it all depends on their skin color, how people respond to it, and the severity of acne scars.
Is there something like a regimen that they have to...
Typically, there is no specific regimen. However, you do have to take care of the skin for a week after the procedure, because there will be some redness and swelling after the procedure, and the patients should expect that.
So you're using this fractional laser. It sounds a little scary. Is it painful at all?
So, very good question. It's actually not. We put a lot of effort into making sure that patients have a very comfortable time during the clinic. So they come in, we put a topical numbing on them for about an hour, and we use special equipment. One is a chiller that chills the face, and using these two combination, basically the pain is very minimal. For the most part, patients say that the pain is 2 out of 10, which is very tolerable.
2 out of 10.
Yes.
I get that every day. It's not bad. And that's the general anesthesia. It's a topical anesthesia?
Yes, it's topical. Everybody's up and awake. We're talking about daily stuff and we're telling jokes. That's what's going on.
Oh, that's great. So, okay, they get one session. How much improvement would they think they'd see? How much do you think should they expect to see after one treatment?
So typically, I tell the patients that they require between 2 to 3 sessions. And after 2 to 3 sessions, they should expect anywhere between 40 to 50% improvement. However, there's some patients that after one session they get 50% improvement. Everybody will respond differently to the treatments, so it's very hard to predict.
In general, though, is it pretty soon afterwards, or does it take weeks to sort of show up? Or
It takes weeks to show up because we are stimulating the collagen within your skin. So that collagen production takes time for it to fill in the scars. But the longer you wait, actually, the better the face is going to look. And there's studies that show that even up to 1 year, there's still continuous collagen production going on after one procedure.
oh wow,
So sometimes we stack a couple of the procedures over several months period, and after 6 months, the patients are very happy with the results.
okay. I'm going to ask you what I asked him. What makes a good candidate for this procedure?
What makes a very good candidate is people that have depressed acne scars, and as long as that their skin tone is not very dark, they are a good candidate for the procedure. The lighter the skin, the better candidate you are, because we could use higher energy levels, and in order to achieve better results.
I see. Okay, now I'm going to ask two of you at the same time. So why should people come to your practice? Why choose you guys?
Well, with regards to the hair restoration, we had decided a long time ago that we're going to dedicate one day for one patient. We're going to dedicate all our efforts, technicians, and resources to one patient a day. And that has made a huge difference in our practice. Patients have better results, minimal discomfort, and as a result of that, we get a lot of referrals from our previous patients.
Okay.
With respect to the acne scars, first of all, I was trained under a very popular physician who had a lot of these lasers in our clinic, and he, in fact, did a lot of the clinical trials. So we had a lot of these laser prototypes before anybody else in the country had them.
Oh.
So we had a lot of exposure to those lasers, and I started doing it at a very early stage. In addition, I do a lot of these acne scar procedures. I'm an acne scar specialist. So I'm not like somebody else who just picks up a laser and starts doing acne scars. There are a lot of other modalities that I use, and I combine with the laser treatments for acne scars. So I provide a much more comprehensive approach to acne scars as opposed to somebody else. I also basically have a lot more experience. So I do a lot more laser resurfacing in LA than anybody else.
That's great. Well, Dr. Sean and Dr. Ben, it's been great having you on LA Business Spotlight. Tell people how they can reach you.
For hair loss and hair restoration, people can either go onto our website at www.igethair.com, or they can reach us direct at 1-800-889-HAIR. For the laser resurfacing, you could go on our website, 68laser.com, or just call us at 1-800-68-LASER.
All right, Dr. Sean, Dr. Ben, thank you very much for being on LA Business Spotlight.
Thank you.
Thank you.
You've been listening to LA Business Spotlight. If you have a company or service and you'd like to appear on the show, send an email to info@iceboxlogic.net.
This podcast was recorded at the studios of Icebox Logic.